All right, let's talk about telehealth in Brazil. In just a couple of years, it has absolutely exploded, right? But it's also become this massive, really complex puzzle. So today, that's what we're going to do. We're going to piece it all together. We'll look at who's making the rules, what your rights are as a patient, and where this whole thing is headed.
So, what lit the fuse? Well, in a word, the pandemic. Just get a load at this number. Since the beginning of 2023 alone, Brazil's public health system, we're talking the SUS, has done over 4.6 million teleattendances. I mean, this isn't just some passing trend. It's a fundamental, irreversible shift in how healthcare is delivered.
And this wasn't just, a temporary fix to get through lockdowns. Not at all. As this analysis from back in 2020 showed, this growth fundamentally expanded access to healthcare for tons of people. Yet private networks like SulAmérica and Amil that saw their teleconsultations just shoot through the roof, from maybe a few hundred to literally hundreds of thousands. It connected more people to doctors than ever before.
But here's where we find the first really tricky piece of our puzzle. This incredible, explosive growth happened so fast that it completely outran the rules. It basically created a regulatory vacuum which, as you can imagine, sparked a huge debate.
And this one question, this simple question, it pretty much ignited a massive power struggle. Who actually gets to define the future of digital health for an entire country of over 200 million people? Yeah, the answer is, it's not simple at all.
And you can just see from this timeline how stuck this whole conversation was for years. You have a rule from 2002. 2002! That was the standard for almost 2 decades. Then a new proposal in 2018 caused such an uproar it was canceled almost immediately. It literally took a global pandemic to force a temporary law, and that's what sparked this frantic scramble for control that finally led to permanent rules in 2022.
Okay, so the core of the conflict really boils down to this. On one side, you've got the Federal Council of Medicine, the CFM. It's a type of federal body called an autarkia, which gives it the legal power to regulate the medical profession itself. So they see telehealth as a medical act, and therefore it's their job to regulate it. But on the other side, you've got the national legislature, right, the state, which argues, whoa, hold on. Regulating a service that affects millions of citizens, that's a matter for national law, not just one professional group. So, with no single authority really in charge, this power vacuum meant that different professions just started creating their own, totally separate rulebooks. Instead of getting one big, coherent picture, we ended up with a pile of puzzle pieces that, well, they just didn't quite fit together. So first up, in 2022, the Federal Council of Medicine finally released its official rules. It defined telemedicine across 7 different modes, everything from teleconsultation to even telesurgery. But, and this is a big but, it was very careful to frame all of it as just a complement to in-person care, which it still calls the gold standard.
And it wasn't just the doctors, oh no. The Federal Council of Nursing followed right behind them, creating its own distinct system. They call it teleinformagem, or telenursing, and it has its own specific rules for how nurses and technicians can practice remotely. See the pattern here?
Then you have the pharmacists. And you guessed it, they created their own rulebook too. The Federal Council of Pharmacy established telefarmacia, but they threw in a major restriction. While you can have remote consultations, the actual dispensing of medication, that's forbidden. That is to be an in-person, face-to-face act.
And just to show you how much this is all still in flux, the rules just keep shifting. Psychology recently updated its whole approach, getting rid of a mandatory registry for online practice. Instead, their new rules focus more on the ethical duties of the psychologist. You can really see how each profession is kind of building its own little silo, right?
Okay, so with all these different rulebooks floating around, you're probably asking yourself, all right, but what does any of this mean for me as a patient? This is where all those puzzle pieces start to affect you directly. So let's break it down.
Well, if you have a private health plan, this is where it gets interesting. The National Health Agency, the ANS, has stepped in with some new rules. Your health plan operator now has very clear, mandatory deadlines to get back to you. We're talking an immediate response for emergencies, within 5 business days for most standard requests, and up to 10 days for the really complex stuff.
And these rules also give you, the patient, a lot more power and transparency.
Operators now have to give you a tracking number for every request you make. They have to let you follow it online, and this one is key. If they deny coverage for something, they have to give you that denial in writing, automatically. No more vague no's over the phone.
But what about the actual consultation? Once you're on the video call with a doctor, what can they actually do for you digitally? Well, the rules here are a bit more fluid, based more on general practice than hard law.
So in practice, what does this actually look like? Well, you can definitely get prescriptions for a lot of common medications, like antibiotics. You can get requests for exams, and even certificates for work absence. But the things that require a hands-on physical exam, like a fitness certificate for sports or for a public service job, yeah, that's generally off-limits for a teleconsultation. Makes sense, right?
So here we are. We've got all these separate puzzle pieces. Rules from doctors, from nurses, from pharmacists, from the health plans. The massive challenge now is figuring out how to make them all fit together into one coherent picture for the future of Brazilian healthcare.
And look, this isn't just my opinion. An analysis from the Institute for Supplementary Health Studies put it really bluntly. They said without unified legislation, the shot is fired for all sides. And that fragmentation, it creates all this confusion and tension, and it makes a truly integrated digital health strategy, well, nearly impossible.
So what's the solution then? How do you fix this? Well, one idea that's really gaining traction is putting a system of corporate governance in place. Now, that's a kind of fancy term, but it's basically a framework designed to get everyone to the same table. We're talking medical councils, hospitals, the government, tech startups, patient groups, everybody, to align their interests and build a system that actually works for everyone.
Ultimately, as Brazil keeps trying to assemble this telehealth puzzle, the final question isn't really about which council or which agency wins the power struggle. It's about how to design a system that's innovative, that's efficient, and above all, that ensures the most important piece of the entire puzzle, you, the patient, is always right there in the center of the final picture.